Let's get to go. The Select Subcommittee on the Coronavirus Pandemic will come to order. I want to welcome everyone here today. Without objection, the Chair may declare a recess at any time. Pursuant to Rule 7D of the Committee on Oversight and Accountability, and at the discretion of Chairman Comer, Mr. Jordan, a member of the full committee, may participate in today's hearing for the purposes of questions. I now recognize myself for the purpose of making an opening statement. Today, the Select Subcommittee is holding a hearing to examine the Centers for Disease Control and Prevention's policies and decisions during the COVID-19 pandemic. The pandemic sent shockwaves through all aspects of American life: school, work, family, sports, and faith. This was a novel virus. There was much we didn't know, and we didn't know how to react. Educated guesses were the best we could do in some cases, especially early on. But throughout, I maintained hope. And what should have and could have united our country, but did not, instead drove division, unfortunately. I was hopeful that the pandemic could be a unifying force for our country and for the world. After all, a common danger unites even the bitterest enemies. Unfortunately, in many ways, our public health leadership did not always rise to the occasion. Instead of being a calm and trusted voice of science and reason, the American people often felt let down, often deceived, and left damaged. Director Walensky, given how difficult it was to get you here today, with the HHS often negotiating on your behalf, it appears that maybe this administration did not want you to speak regarding these topics. In case you were unaware, nearly 10 weeks ago on April 5th, the Select Subcommittee requested that the CDC make you available to testify today. On May 22nd, the Select Subcommittee officially invited you to testify. Through the negotiation process, the Biden administration said there was insufficient time for you to prepare. Now, this may even astonish you, considering the Select Subcommittee provided nearly 10 weeks' notice. HHS then rejected 2 other later dates and provided more seemingly illogical excuses. Again, in case you were unaware, it took the threat of a subpoena for the administration to finally allow you to attend this hearing. We think that maybe you were willing the whole time, so I want to thank you personally for being here today. It is, however, curious that the administration tried so hard to hide you from the American people. I suppose that some would rather the American people simply move on. But without review of processes and decision-making, it's difficult to plan for the future. And there will be a problem again in the future. It is the duty of this Select Subcommittee to ensure that we address failings so we're not doomed to repeat them. As well, let's affirm the positives. These are our duties and our obligations. Throughout the pandemic, CDC published confusing guidance and made divisive and confusing statements, and we must talk about these things. Director Walensky, you made several of these statements yourself, some that even contradicted CDC's official guidance. We have many questions about some of the statements made by several people and directives made and facts that may be contradictory. Beginning with, on February 3rd, 2021, you said, quote, there is increasing data to suggest that schools can safely reopen, and that safe reopening does not suggest that teachers need to be vaccinated, end quote. The next day, then White House Press Secretary Jen Psaki said, quote, Dr. Walensky spoke to this in her personal capacity, end quote. That's interesting. You were speaking at a White House press briefing when you made the statement. The official CDC logo was behind you, and the transcript is on the White House website. Doesn't sound like personal capacity to me. Seems like the Biden administration just disagreed with what you were saying. And we'll ask you about that today. On March 29, 2021, Director Walensky, you also stated, quote, our data from the CDC today suggests that vaccinated people do not carry the virus, don't get sick, end quote. 3 days later, a CDC spokesman walked this back and said that you were speaking broadly and that some people who are fully vaccinated might indeed catch COVID-19. So this raises the question of whether the science supported what you were publicly saying or not. The lack of scientific awareness of the Biden administration became clear when on July 21, 2021, President Biden made the unequivocal statement, if you're vaccinated, you're not going to be hospitalized. You're not going to be in the intensive care unit, and you are not going to die. We will ask you about that and are interested in hearing if the data CDC had at the time supported that statement, or if it was made for political or other purposes. At times, CDC seemingly accepted guidance from political organizations instead of relying on the real-time scientific data. At our hearing in April with the American Federation of Teachers, President Randi Weingarten, we examined its interactions with the CDC. Dr. Henry Walke, a scientist at the CDC, described AFT's level of access as uncommon. Ms. Weingarten testified to having your direct phone number and provided the CDC with line-by-line edits and received an advance copy of the full internal draft guidance. And some of her edits were even accepted. This level of access is uncommon. The AFT even suggested adding a closure trigger to automatically shut schools down. Even though this specific edit was not accepted, the others that were have had some severe consequences. And I believe it's appropriate for the AFT to seek CDC guidance, but not to give you or the CDC medical and scientific advice. Drug use, violence, mental health issues, and suicide among our nation's children have skyrocketed, while test scores have severely fallen. Some will attempt to undermine the Select Subcommittee's efforts by saying that hindsight is 20/20, or that we are playing Monday morning quarterback. But our role is to investigate the COVID-19 pandemic. This requires looking back in order to plan ahead. It requires asking questions to evaluate how decisions were made and how they were implemented. And once that is done, we may put forth solutions based on facts, not suppositions. So I look forward to a strong, respectful, and on-topic discussion. Honesty is non-negotiable. Again, I thank you for being here today, voluntarily, and I look forward to your testimony. And with that, I yield to the ranking member, Dr. Ruiz, for any opening statement he would like to make.
Thank you, Mr. Chairman, and thank you, Director Walensky, for being here today. As ranking member of this Select Subcommittee, I've often said how important it is that we focus on forward-looking policy solutions that will leave us better prepared in the event of another deadly novel airborne virus. At the forefront of this work is the nation's Center for Disease Control and Prevention, which, under Director Walensky's direction, helped guide us out of the darkest days of the COVID-19 pandemic. Her steadfast leadership mobilized the most successful vaccination campaign in our nation's history, leading to more than 600 million shots in arms, prevented 18.5 million hospitalizations, and saved 3.2 million lives from COVID-19. Under her leadership, 95% of America's schools that were forced to close during the previous administration's failed pandemic response safely reopened for in-person learning within just 1 year. And because of her tireless efforts, our nation's public health workforce was fortified, and the CDC made critical strides to ensure that the American people received accurate, data-informed public health guidance that reflected what we knew about an evolving, ever-changing pandemic at crucial points in time. I say all this to not only thank Dr. Walensky for her service to the nation, but also to stress where we were and where we are today because of her leadership. You see, when Dr. Walensky began her tenure at the CDC, she inherited a beleaguered agency during the pandemic's deadliest 2-month stretch on record in the United States. In fact, every day, more than 3,000 people in the United States died from COVID-19. What's more, Dr. Walensky ascended to the role as director not only as the agency was in the midst of battling a deadly novel virus, but also as it was suffering from the severe setbacks and damaged morale that resulted from months of political interference by the former president and his administration. Throughout the early months of the pandemic, our nation's scientists were sidelined by White House officials and the president's political allies who meddled in CDC's communications, public health guidance, and scientific reports. That's in addition to the president's own downplaying of the coronavirus, which hampered our nation's pandemic response during one of the deadliest periods in America's history. This political interference and harmful messaging by the former president also manufactured a deep distrust in our nation's public health institutions, fundamentally undermining our ability to respond to future threats. That, coupled with the ongoing vilification of public health experts with the purpose of advancing a partisan narrative, and now we're seeing the real and dangerous consequence. In fact, a February 2022 Pew Research Center report found that fewer than 3 in 10 adults in the United States now have a great deal of confidence in medical scientists to act in the public's interests. As a physician and public health expert, this is deeply concerning to me, and it should be to us all. Our ability to prevent harm and save lives in the event of another pandemic is intrinsically tied to a strong relationship between our nation's public health experts and the American people. So where do we go from here? How do we move forward? Now that we are on the other side of this pandemic, thanks to Director Walensky and the Biden administration's leadership in delivering vaccines and safely reopening workplaces, schools, and our economy, we have the opportunity to rebuild the trust that has been eroded. We have the chance to right the wrongs of the previous administration by identifying and implementing real solutions that leave us better prepared in the event of another deadly virus. Solutions like empowering the CDC to promote comprehensive and timely data collection and reporting, equipping the CDC with tools and resources necessary to continue rapidly disseminating accurate information and guidance to the American public without political interference, and investing in the CDC so that it can continue to support its states and local partners in the face of future public health threats. It is now that we should work to re-inspire confidence in our nation's public health officials, not continue to vilify, falsify motives, and breed distrust in them. It is now that we should continue to assemble a strong public health workforce and see through Director Walensky's vision for the CDC to identify, prevent, and respond to novel viruses and threats more nimbly. And it is now that we should build on the Biden administration's progress to bolster whole-of-government pandemic preparedness so that we can more rapidly respond in a future public health crisis. So today, I hope we can make progress on advancing these objectives, because if we do, we can and will ensure the nation is better prepared in a future public health crisis. And that means future harm will be prevented and more lives will be saved. Thank you, and I yield back.
Thank you, Dr. Rees. Our witness today is Dr. Rochelle Walensky. Dr. Walensky currently serves as the director of the Centers for Disease Control and Prevention. She was previously the chief of Division of Infectious Diseases at Massachusetts General Hospital and a professor of medicine at Harvard Medical School. Dr. Walensky graduated with a Bachelor of Arts from Washington University in St. Louis, received a Doctor of Medicine from Johns Hopkins School of Medicine, and a Master of Public Health from the Harvard School of Public Health. Thank you for being here today. Pursuant to Committee on Oversight and Accountability Rule 9G, the witness will please stand and raise her right hand. Thank you. Do you solemnly swear or affirm that the testimony that you are about to give is the truth, the whole truth, and nothing but the truth, so help you God? Thank you. Let the record show that the witness answered in the affirmative. The Select Subcommittee certainly appreciates you being here today, and we look forward to your testimony. Let me remind the witness that we have read your written statement, and it will appear in full in the hearing record. Please limit your oral statement to 5 minutes. As a reminder, please press the button on the microphone in front of you so that it is on and the members can hear you. When you begin to speak, the light in front of you will turn green. After 4 minutes, the light will turn yellow. When the red light comes on, your 5 minutes has expired, and we would ask that you please wrap up. I now recognize Dr. Walensky to give an opening statement.
Thank you. Chairman Wenstrup, Ranking Member Ruiz, and distinguished members of the subcommittee, it is an honor to be here with you today. I came to CDC in January of 2021 as a practicing infectious disease doctor and researcher who had been on the front lines of the pandemic treating patients with COVID-19. I leave later this month with a great sense of accomplishment that the public health emergency has ended, and with an unwavering respect and admiration for the dedicated people across CDC working every day to protect the health of Americans. When I started, CDC faced enormous challenges. For example, the sharing of data was too slow and often relied on fax machines, which greatly hindered federal, state, and local leaders from having timely access to critical public health data. As a nation, we have mourned the loss of more than 1.1 million family members, neighbors, colleagues, and friends from COVID-19. And we cannot lose sight of the fact that we are still losing people to this disease every single day. But thankfully, we are in a much different place today. The end of the public health emergency last month marked a tremendous transition for our country and for public health. Now we have the tools we need to protect people in our communities from severe infection and death. Thanks to the work of CDC, our partners in state and local government, the private sector, and frontline healthcare workers, more than 676 million doses of vaccines have been administered across the U.S., saving millions of lives. These vaccines built a wall of protection which dramatically decreased the risk of severe disease and death from COVID-19. When I started at CDC, just 1/3 of school districts were offering daily in-person instruction. With my 3 boys at home with me, getting schools open was a top priority for me. I, like many of you, recognize the critical role that schools play in supporting social, physical, behavioral, emotional, and mental well-being of our children. In fact, one of the first guidance documents released by CDC just 23 days after I started was the operational strategy for K-12 schools through phased mitigation on February 12, 2021. This roadmap to reopen schools and help them remain open was the result of countless work hours by CDC staff, along with feedback from over 50 organizations and implementing partners. Organizations and individuals whose engagement we needed, whose participation was essential if school opening was actually going to happen. And it worked. By the fall of 2021, nearly every school district in the United States offered daily in-person instruction. Throughout my tenure as CDC director, I used the best available and often emerging data to inform real-time policy decisions. Rarely did we see new scientific findings that were immediately and unanimously clear and consistent. But at CDC, we have a strong commitment to acting quickly with transparency when new science gives us better ways to protect the public health needs of our most vulnerable. For example, when 2 studies were released in March of 2021 showing that we could reduce physical distancing in schools from 6 feet to 3 feet, we acted to release new updated school guidance just 4 weeks after our initial effort. Fortunately, today we know so much more about this virus than we did when it first emerged. And in 2023, we believe the darkest days of this pandemic are now part of our history. Despite important accomplishments and improvements to our public health lab capacities, expanded ability to collect and share high-quality public health data, and bolstered public health infrastructure, CDC still has more work to do, and I am deeply motivated to make improvements based on what I had seen. I launched an all-agency review, CDC Moving Forward, in April of 2022 to address the lessons learned from COVID-19, increase accountability, and improve how we deliver information to Americans. As CDC continues this internal work, we need partnership with Congress to better position CDC for success. In closing, the rate of infectious disease threats that I have seen as CDC director should be a warning to us all. As a nation, we failed to heed the lessons from previous disease outbreaks. We are once again faced with opportunity. Collectively, we should focus our work on moving the agency and public health forward. Our response to the next infectious threat relies on how we come together and have productive conversations about supporting a more prepared America. I commit to further this goal in my last weeks at CDC and beyond. It's too important, and too many lives are at stake. I hope you will continue to work with me and CDC to support sustainable public health investments and updated authorities that will protect the security of Americans by being better prepared for tomorrow's health threats. Thank you, and I look forward to your questions.